I'd like to start off my talk with a story. Now, this is Dr. Angela Anderson. She's a doctor in family medicine located in Indiana. Now, one day she reported feeling chest pains and, like everybody else, went to a healthcare provider. Now, the first healthcare provider she went to turned her away after waiting for over an hour. The second healthcare provider she went to gave her a simple COVID test, and when it came back negative, they told her that she probably just had a congested nose. It was only after through persisting that they finally gave her physical examinations. When it came to giving her her blood oxygen readings, she was told that the device doesn't work on colored fingers. Now, Dr. Anderson is just a human like you and me. She deserves the proper health care when she needs it. So why does she and millions of Americans have so much trouble with their healthcare industry? Now, in the meantime, I'd like everyone to imagine a number. 20%. How big is 20%? For example, 20% of 1 billion is 200 million, so it can be quite large. Now, what if I said we could reduce something by 20%? And what if that 20% was a life or death question? What if I said we could reduce the mortality rate gap for cardiovascular diseases by 20%? So then what does this figure have to do with the story above? A recent study suggests that racism within the healthcare industry plays a significant role in the mortality rate gap between white people and black people in America. While the socioeconomic problem is a problem that exists and persists, I am simply saying that this other factor needs to be considered as well. In the meantime, I'd like everyone to look at a graph. Now, as you can see, the top blue line represents the total percentage of black people as a whole of the US population, while the bottom three lines represent black people as percentage of US populations separating between men and women. As you can see, there's a clear disparity between the percentage of black people as a population in America and the percentage of black people working as physicians in the US. And in general, the percentage of black physicians in the US has barely changed over 100 years. A study conducted by Boulware et al. Seemed to show that black people were less trusting of their white physicians, especially when it came to more experimental treatments. They seemed more concerned with their privacy and safety. So all of this seemed to suggest that black patients were more comfortable with black doctors performing experimental but potentially life-saving treatments than if their physicians were of another race. Another study by the National Academy of Medicine showed that racism from within the healthcare workers also played a significant role. In general, black people were in one example, black people were less likely to receive higher quality medicine for cardiovascular diseases than white patients with the same diagnosis. Black people were often discharged earlier than their white patients, in some cases before they even should be allowed to. And the rates at which black people receive amputations is far higher than white people in the US. So all of this seems to suggest that race seems to play a more significant role in the healthcare industry than we originally thought. So what can we do about this problem? Unfortunately, with a problem this complex, there is not one simple solution. There are many things that we can try. Some may help, but some also may make the situation worse. But there are a few known things that we can do right now, such as short-term solutions, such as raising awareness within the healthcare industry and workers, making sure that the equipment works on everybody, to more longer-term solutions, such as targeting young black talent within the educational sector and helping them out with expensive medical school. But ultimately, the goal of my talk today is to help raise awareness with you all this often unnoticed problem with the healthcare industry. Thank you for watching.